Hello everyone, I'm Dr. Rohit Verma, consultant physiotherapist. Today discuss about AS. Ankylosing spondylitis is a chronic inflammatory arthritis that primarily affects the spine and sacroiliac joints, the joints connecting the lower spine to the pelvis. It belongs to a group of conditions called spondyloarthropathies, also known as bamboo spine. Causes, gender and age. Ankylosing spondylitis is more commonly diagnosed in males than females. Symptoms usually start in late adolescence or early adulthood, typically between the ages of 15 and 30 years. Genetics. The strongest risk factor for developing ankylosing spondylitis is having specific genetic markers, particularly the HLA-B27 gene. About 90% of individuals with AS carry the HLA-B27 gene, although having this gene does not guarantee that a person will develop the condition. It is thought that certain other genetic factors may also play a role in the disease's development. Autoimmune factors. Ankylosing spondylitis is considered an autoimmune disease, which means that the body's immune system mistakenly attacks its own tissues. Family history. Having a family history of ankylosing spondylitis or other related conditions. Sign and symptoms. Back pain. Persistent and often worsening pain in the lower back and buttocks is one of the earliest and most common symptoms. Stiffness. People with AS often experience stiffness and reduced flexibility in the back, particularly in the morning or after long periods of inactivity. Pain in other joints. Apart from the spine, AS can also affect other joints, such as the hips, shoulders, and knees. These symptoms may come and go and can vary in intensity. Fatigue. Chronic inflammation and pain can lead to fatigue and a general feeling of being unwell. Loss of mobility. As the disease progresses, some individuals may experience decreased mobility in the spine, leading to a stooped posture. Enthesitis, inflammation at the sites where tendons and ligaments attach to bones, commonly affecting the heels, can cause pain and swelling. Chest pain and breathing difficulties. In diagnosis, imaging tests, X-rays can reveal changes in the sacroiliac joints, which are often affected in AS. MRI is more sensitive in detecting early signs of inflammation and can help visualize the spine and other joints in greater detail. Blood tests. Certain blood tests may be ordered to check for specific markers of inflammation, such as C-reactive protein CRP-ESR. The presence of the HLA-B27 gene is also commonly associated with AS. Physiotherapy examinations. Physiotherapist. The doctor will conduct a physical examination to assess the patient's range of motion. Joint medical treatment. Non-steroidal anti-inflammatory drugs, NSAIDs. These medications are often the first line of treatment for AS. NSAIDs can help reduce pain, inflammation, and stiffness. Disease-modifying antirheumatic drugs, DMARDs. If NSAIDs are insufficient in controlling symptoms, DMARDs may be prescribed. These drugs work by suppressing the immune system and can help slow the progression of AS. Sulfasalazine and methotrexate are examples of DMARDs used in AS. Biologic medications. Biologics are a newer class of drugs that specifically target certain proteins involved in the inflammatory process. Tumor necrosis. Physiotherapy treatment, education and self-management. Physiotherapists educate patients about the nature of AS, the importance of exercise, and the benefits of maintaining good posture. Exercise programs. A tailored exercise program is vital in the management of AS. It helps maintain joint flexibility, muscle strength, and cardiovascular fitness. Gentle exercises such as stretching, range of motion exercises, and low-impact aerobic activities, e.g., swimming, cycling, are commonly prescribed. Posture training. Good posture is essential for AS patients to maintain proper alignment of the spine and prevent undue stress on the joints. Physiotherapists teach patients about correct sitting, standing, and sleeping positions. Breathing exercises. Deep breathing exercises help pain management. Heat therapy, such as warm packs or warm baths, may help reduce pain and muscle stiffness. Cold packs can be used to alleviate inflammation during flare-ups. Manual therapy. Gentle hands-on techniques may be used by physiotherapists to improve joint mobility, reduce muscle tension, and alleviate pain. Hydrotherapy. Aquatic exercises in a warm pool can be beneficial for AS patients as the buoyancy of water reduces the pressure on the joints and allows for a greater range of motion. Assistive devices. Physiotherapists may recommend or prescribe assistive devices, such as braces or walking aids, to support the spine and improve mobility. Home exercise program. It is essential for AS patients to continue with their exercises at home as